How did a radical leftist end up in Trump's healthcare agenda?
You're exactly right. How in the world did this guy come in when Trump came in? And so we have people that are still deep state embedded. I can tell you, RFK did not get his first or second choice for CDC director. The new director has been in the system for decades. That should tell you something. Mm-hmm. She's not a medical doctor. She's not a nurse. She's not a medically trained person, cannot treat one person, and she's in charge of the CDC. This was not RFK's first choice or second choice, because I know who his first choice was. He asked me to be the CDC director, and that was shut down by the Trump transition team. And then the second fella, seriously. And so the second person was a doctor who was planning on going through the Senate confirmation hearings, and the Trump transition team pulled the plug on that an hour before the hearings were going to resume. And so I know who the first two choices of RFK were, and this is a default that is put in by, I got to say, it's not an accident that the Trump transition team is still in control. And I don't know if Trump's aware of it, but there seems to be an agenda to have AI embedded, not just as a tool for healthcare, but to replace 9 out of 10 doctors and to further concentrate power under a few people's control. The American people will be under a few people's control, according to Bill Gates. He says in 10 years, he's going to replace 9 out of 10 doctors with AI.